Welcome to the Daily Commercial Forum. I'm your host, Sandy Moore. More than 200,000 people are hospitalized each year from flu-related complications. The flu is a contagious respiratory illness caused by influenza viruses that affect the nose, throat, and lungs. The flu can cause mild to severe illness and can lead to death. Today, we will be talking about who should get a flu vaccine and what you should do if you experience flu symptoms. Our guests today are Captain Deanna Chapman from Lake Emergency Medical Services, and from the Lake County Health Department, Dr. Claude Jones, the Medical Executive Director, and Janet Voigtman, a Senior Registered Nurse. Welcome, everyone.
Thank you.
Thanks.
Thank you.
Dr. Jones, can you tell us what are some typical flu symptoms?
Well, some of the symptoms we typically see are fever, chills, cough, sore throat, body aches, things of that nature.
And can the flu be treated?
Yes, we can. We do have treatments for the flu. Typically, we treat symptomatically, so we try to treat the cough, any pain, any fever the patient may experience. There are also different antiviral medications we have available, such as Tamiflu, which we can use to treat the virus within the first 48 hours of symptoms.
No, that was what I was going to ask. So if you think you're having if you think you're getting the flu, it's important that if you're wanting to get some type of a treatment from a medical standpoint, like from the doctor, you have to go in right away. Is that right?
Yes, right away. If you begin to experience symptoms, you need to speak to your doctor, see if there's any treatments available, see if you're within an appropriate time frame. You also want to avoid any people who aren't sick at home or at work. So the best policy is to stay home and find out what's going on.
And what are antiviral drugs?
Antiviral drugs are used specifically against viruses. So when we talk about antibiotics, antibiotics aren't effective against viruses or the influenza virus specifically. So it's important to note when you're going to see your doctor not to ask for antibiotics because they won't help you.
And what exactly is the procedure? What do they have to do in order to figure out if you have the flu? Is it like a nose swab, or what do they do to figure it out? Or is it just the symptoms that they can tell?
Well, most of the encounters are symptomatically, so you get most of the history from the patient. And if you come in with some of these symptoms, they give us a pretty good idea of what's affecting you. We also do throat cultures, and we can also do nasal cultures for the influenza virus, and we send them off to the lab and wait for them to come back. That's really the only way to actually confirm that you have a viral illness, but most of the times we can go symptomatically.
So you can tell. Because how long would it take to get the lab results back? If you only have 48 hours before it's really it doesn't help to do the drugs, then how long does it take to get the results back?
It usually takes 2 to 3 days to get the results back.
So they would go ahead and start you on the
Exactly.
Okay,
so that's why it's important to get a real good history from the patient when they come in.
Okay. So now how long can a person that is sick spread flu to others?
You can actually start shedding the virus even before you have symptoms. And you can get into shedding about 5 to 7 days.
And when you say shedding, you mean spreading that to other people?
Yes, spreading.
Okay.
So
you're contagious. Even before you know you're sick, you may be contagious.
Right, because
oh, that's great.
because there is a small, what we call an incubation period, where
Okay.
the virus gets into your body and needs time to replicate. So during that time, you are contagious and you can spread it at least up to 5 to 7 days, even after you have symptoms.
Oh, okay. So now, I know that we're already in the flu season. Is that right?
Yeah, it runs
Just
from
started.
it runs from October into May.
Now, I personally I have not gotten my flu vaccine. Janet, should we still get a flu vaccine even if we haven't gotten it at this point?
Absolutely. It's the most important thing you can do to prevent the flu. So that would be the first thing. And you should get it as soon as the flu vaccine comes out, which is usually in September.
I know this is going to sound like a very obvious question, but so that you don't get sick, but why do we get vaccinated for the flu? I mean, what is it about the flu? Because I know the flu's been around for a long time. What is it about? Why is it important that we get vaccinated?
The flu can be a very severe disease, can be a very severe process. particularly in certain people who are at higher risk, which would be typically young children, pregnant women, older people, but anybody can develop significant symptoms. It will take you out of work for maybe even up to a couple of weeks. It can deteriorate into things like pneumonia, which will cause you even more pain and suffering. So it's probably an excellent thing to try and prevent.
And the one big factor, it can result into death. It's very important to get your vaccination as soon as they come out. And like they said, over 200,000 people are hospitalized every year, and over and on an average, 23,000 results in death. And I was talking to our quality development officer, our quality assurance officer yesterday, and I was kind of curious to pull up on average what we transport. And she brought up flu-type symptoms. You know, it's hard for us to generate just a flu-type symptom because sometimes it may come in as fever. It may be being transported for a body ache. So we try to pull up those. And when she queried, in 2010, probably over 700 transports just in the flu-type symptoms. And then we measured it to this year. They have reduced in numbers by half, but we only have 2 months left. But it shows that maybe people or our citizens are not getting the idea that it's important to be vaccinated. Because between the health department, Dr. Jones' efforts, and Lake EMS's efforts, we really promote this. Please get vaccinated, because we do not want to see that happen to you. I mean, it's very, very, very bad. I ended up with the flu one year, and I do not want it again. I will do anything I can not to get it.
Well, and that was one of the things I was thinking, because I don't think I've ever really gotten the flu, and maybe I think once you've had it,
yes,
you're a believer. Maybe in the
and bringing up one factor too. A lot of citizens that have received the shot. We here at Janet and I do a lot of outreach clinics, and we'll talk about that a little later. But the one big thing we always run against is, I don't want it, it made me sick.
Yeah.
I don't want it, it made me sick. But the thing that happens is and Dr. Jones can probably verify, once you receive the shot, it's a dead virus, and your natural antibodies builds up immunity to that, so it may cause symptoms that may result in flu-like symptoms like the aching across the chest, the weakness, that only lasts 1 or 2 days. But for me, I had it for 2.5 weeks. I was the sickest I have ever been, and I would rather have that symptoms for 2 in a day than having the actual flu. I don't know if that was, but it's very important to get it. Today I had symptoms for a couple of days. It's really...
And I've heard that from a lot of people, the ones that don't get it. I will never get that because I got sick when it happened. What were you going to say?
One of the other things that I wanted to mention is that a lot of people get very confused about the difference between a cold and a flu. Both are caused by viruses, but different viruses. A cold is very limited. You get the sniffles. You typically don't get a fever. You might have a little cough, and it goes away in a few days. The flu is something entirely different. It's a beast of a different color, and it is really a very serious. Can be a very serious disease.
So really, even though that we recommend, and I think we're going to talk about this pretty soon, but that I know that there are certain risk factors. You really say anybody should get it.
Yes.
Anybody. How many people?
6 months or younger.
6 months or older.
6 months.
Right, and we're going to go over some of the specifics of that in just 1 second. But how many people on average got the flu last year in the United States? Do you know that?
I think the numbers right now, we're looking at about 200,000 people who are actually go in and are treated.
Go into the doctor.
Or come in with symptoms, or at hospitals, right?
And that's not, and I want to also bring up, like Janet alluded to, the pneumonia. The pneumonia shot is very important too. And when you get into talking about the vaccines, the one thing about influenza, it does lead into pneumonia, and that's what results in death. Most of that bacterial infection that causes the lungs. That's and that's a very important immunization to get also. And we do provide that throughout the year.
So tell me, who are the highest at risk for getting the flu, or that really need to get the vaccine because of, I guess, getting the flu results in other things?
The people at highest risk would be small children, pregnant women, people with chronic health conditions such as heart conditions, lung conditions, kidney problems, diabetes, that sort of thing. And also people who are 65 and older.
And also you have to think about immunocompromised individuals, people with HIV, individuals with cancer who may be using anti-cancer drugs, medications. You have to worry about those people.
And
also.
most of these people probably have been instructed by their doctor to.
And
get
and
this
also healthcare workers.
Well, and you know, and you say that, and what
That's
about
right.
teachers? I would think that that would be somebody that should probably do this because
Yeah.
Teachers.
there. I know that when I used to work with kids, you get as soon as it started, you'd get sick, and it would just kind of carry through.
And look at the daycares, you know.
Yeah,
Right.
that's right.
Poor kids coming in, like Dr. Jones alluded to, that it could be one day you didn't know you were sick, and you've already exposed everyone
Right.
to the virus or bacterial.
Is there only one type of flu vaccine?
No, we have different types. Some of the main ones we use are what's called the inactivated form, and we also have what's called the live attenuated form of the vaccine. The live attenuated form we actually give intranasally through a spray, and the inactivated form we give intramuscularly with a shot injection.
Okay, so tell me the difference between the two. I mean, I know you talked about one you get through the nose, or through a spray, but what's the difference?
Okay, one actually has a live component of the virus, but it's a weakened, so we call it attenuated. The other form
Is there more of a chance that you would get sick because there's a little bit of the live virus in that, or?
Right. As we mentioned earlier, if you use the live attenuated form, there's a chance that your body would actually have a response to it, because what happens with a vaccine is we're doing what's called passive immunity. So we're trying to give you a piece of the virus so your body sees it, makes a memory to it, makes antibodies, and actually attacks it. So when your body sees it again during the season, you already have the antibodies to fight it.
Okay. And then the one the shot is the one that's already dead.
Correct.
Okay.
That's right.
And does one work better than the other?
Well, it all depends on the age group. It all depends on if you're at higher risk, if you're immunocompromised, you probably don't want to get the live attenuated virus. You want to get the inactivated form.
Okay.
So it depends on the patient.
The live attenuated virus, the nasal spray, works very well in young children.
Now, we had started to talk about this, I think you said below 6 months, who should not get the flu virus. Who is that?
It's anyone that is allergic to eggs, feathers, any type of anyone that has been sick.
Say that eggs or?
Eggs,
Oh,
feathers,
Chicken
feathers,
eggs or chicken feathers.
chicken feathers, anything to do with the chickens.
well, because my son is allergic to feathers, but I would have not thought that.
Well, I think you just probably talk to your doctor about
Okay.
it, and he would advise you more. And anyone that had a reaction to it before, allergic reaction. And then
Guillain-Barré syndrome.
Guillain-Barré.
If you've developed, it's a kind of a paralysis that occurs. It happens more often as a result of having the flu than it does with having the flu vaccine. But if you've developed this syndrome within 6 weeks, within 6 weeks after having the flu vaccine, they are a little hesitant to give it to you, the flu vaccine.
and
again.
explain
So
exactly what that is again, you said?
Guillain-Barré, it's a well, we're not exactly sure
It's a neurological.
why,
Okay.
why it
Neurological.
happens, but it's a neurological.
What Guillain-Barré is actually a very rare disorder. It's actually caused by your body trying to attack the virus, but it actually attacks the nerves. So it's actually a form of what we call peripheral neuropathy. So you tend to get weakness and paralysis starting in the hands and feet first. So you may experience some weakness, you can't hold a cup, and now it develops into what's called a ascending paralysis. So it tends to go up both arms, both legs, and make its way to what we call the trunk, which is this area. It can lead to respiratory distress, different respiratory illnesses if it's not treated in time. But if it's caught and the symptoms are found in time, it's very treatable.
That would be very scary, I would think.
But it's important to remember that there are only maybe 1 or 2 cases of Guillain-Barré per every million doses of the flu vaccine that are given. So it's very, very rare.
Very rare.
And then one other thing too, where you're not able to get it is if you have a fever. And I think the last studies that said that as long as they can have a cold, but or even a low-grade fever and still have the shot, but no high fever or anyone's sick.
And going back to the syndrome that we were talking about, it's a temporary thing though, right? I mean, it will go away eventually.
What, Guillain-Barré?
Yeah.
Yeah.
Guillain-Barré.
Just to not panic anyway. Because
Well, treatment is what we call supportive.
Okay.
However, it can worsen into, like I told you, respiratory distress.
Right.
If it's not treated by a process what we call plasmapheresis.
Okay.
Okay, so it can become worse, and it is dangerous, but however, it's rare.
Now, as I was reading a little bit on the flu, I know more than I've ever known before, I have to say. I saw something about high-dose inactive vaccine. And what's the difference between that and just your regular vaccine that you get from, I know you can go like now to Walgreens, our church had it at one point, you can go to all different places to get vaccinated. Can you get a high-dose vaccine somewhere else, and who needs that, and tell me about that?
High-dose vaccines are typically used for individuals 64 years of age or older, and we give this because at that age your immune response isn't like it used to be when you were 15, 20 years old. So as you age, your immune response tends to go down. So we give a higher dose to make sure those individuals are able to have an immune response.
So really with the more high risk of older. Okay, so what kind of actions, Janet, tell us what are some of the actions that we can take to prevent the spread of the flu?
Oh,
Or germs.
First of all, if you get the flu or feel like you're getting the flu, please do not go to work. Your colleagues don't want it either. So stay home. That's the number one. Number two is to prevent you from getting it at all. Get your flu vaccine, first of all. Second, keep your hands clean. Keep your hands washed. I carry hand sanitizer with me everywhere. Wash your hands before meals, after meals, cooking. If you happen to sneeze or cough, and you're using your hands to accomplish that, you need to wash your hands, please, definitely. So those are the very important things, I think.
Well, and you're talking about washing your hands, and I want to say that Deanna, you might have been here. I took a Leadership Lake County class, and I think Deanna might have even taught this class, or this part of it was at the Health Day for Leadership Lake County, and they talked about the proper way to wash your hands, and I'm thinking, okay, this is very silly that we're all learning this, but there is a proper way to wash your hands. And I learned a little trick, which I'm sure you're going to share, but that you're supposed to sing Happy Birthday while you're washing your hands.
Yes.
And that's the appropriate time.
Yeah.
But what else? How is there some other
I didn't
things?
teach it, but I
thought you were there. You must have been there.
I was in late leadership, and I went through the same process, and I'm thinking, my goodness. And I also want to bring up that the health department does provide a hand washing brochure. It does real well. Because I was reading through this when Sherry gave it to me to hand out at the fairs, and it's amazing what all you need to do. And it makes you go through the process of every time you touch your pet, wash your hands. Every time you pick up this, wash your hands. Every time you touch your eyes, your mouth, don't touch your eyes and mouth unless you've washed your hands. And it's under the water, rubbing, and then you have to actually soap it with warm water, and you have to sing Happy Birthday, and then and make sure you're under the rings, take the rings off, make sure you're dry under the rings, anything that's on your hands, bracelets, and it's just really a whole.
Well, if
whole
there are
ritual.
any other parents out there of boys like I have, this is mortifying to think that this is, because I'm just happy if they wash their hands maybe twice a day.
That's
I'm
me.
just thrilled if I don't see dirt
Right.
continually, because it's a battle to do that. So,
Yes.
but there is a proper way to wash your hand. And it is really important, especially if you're working with other people and you're shaking hands. And the other thing what I think they talked about is not touching.
Do not touch your eyes. If you haven't washed your hands, don't touch your eyes and mouth. That's how things spread. And you don't realize that you cough or you cough into your hand, how it spreads. And I go to shake someone's hand, or I touch the pen she's going to use, pens.
Right.
It could be anything. I mean, it's amazing how the different ways you can spread the viruses may happen. But washing your hands, being on a paramedic for years, that was just part of our routine. Even though we wear gloves, we still wash our hands because from patient to patient, it's just more
So is
clean and
this pretty
sanitary.
much the most important
stay home is
way.
the most important when you're sick.
Stay home.
Yeah, I'm a workaholic. I do the same thing. If I get a sore throat, I'll take some drugs, some medicines to make me feel better, and I'll go to work. But it really isn't fair to your coworkers who are going to end up spreading it to their kids. So, but it is
When
hard.
you
It
don't
is
know,
hard. Right.
if you can spread it and you don't know, then really washing your hands and
Yes.
making sure that's going to be your.
you from giving
That
it
is
to
a
other people.
big thing, is washing your hands.
Well, and I know I've been on cruises before, and that's one of the things that they have posted everywhere. I think
Yes.
after that one cruise ship where everyone got sick, they have posted everywhere about washing your hands.
And then remember, if you don't have soap and water, you do have the alcohol sanitizer. Carry a bottle with you at all times.
The hand sanitizer, yes.
Yes.
I need to
It's very
refill
important.
that.
Yeah.
Janet, where can someone get a flu vaccine? I know I mentioned a few, but
There are flu vaccines available everywywhere.
do you have some today? Because I don't.
But I can bring it back. We have it at the health department.
Okay.
First of all, we also provide. We do outreach clinics and that sort of thing, so we do provide that. You can get a flu vaccine at any drugstore almost, at any doctor's office, any number of stores locally will provide it as well, and you might be able to find it in pharmacies of places like Target or Walmart, that sort of thing. So flu vaccines are everywhere.
And how much does it cost typically to get a flu vaccine?
Probably anywhere. I've seen anywhere from $20 to $30, approximately that.
But primarily it's 25 for the flu in Lake County, and 45 for the pneumonia, and 45 for the high dose.
Okay.
Now we do an outreach clinic. Janet and I, with Lake EMS and Lake County Health Department, have a partnership. And what we like to do is set up at private organizations or private parks, like Hawthorne, in places that way. That way they can actually stay at home. We'll bring the shots to their residence area and advertise it, and they all come to their park. That we don't have to go out, and if they're not able to get out as much, we can just bring it to their backyard actually.
And so if somebody is homebound,
Oh yes, we have another homebound
yes.
program that we're very proud of, and they can actually call my office at 383-4554.
and that's a 352?
Yes, 352 number, and to set up the clinics from there. Now, from the homebound, we'll have a different line, and we'll actually promote that through the newspapers at the time when it starts. And they're able to call in. We actually put them on a track. We'll do the east end, the west end, the south end, and then we'll actually bring the flu shot and pneumonia shot to their home. I had one of the caregivers talk to me this year and was just ecstatic about the program, because she would have to pay for a transport agency, get a lift to put her mother in the transport, which cost her to transport to and from just to get one shot for $25. So for us to just transport the shot to her, she was just amazed, and she loved the idea. And we've been doing it since 2001.
And is that an additional expense to people? No.
No, we do it for community relations because we think it's the right thing to do for them. And it's just a 3-day process or 4-day process and take it to like an area. We'll do Eustis and Umatilla and Grand Island area, and then we'll go and do the South End, and then we'll take it to the West End and the villages. And we track a little, they get lost a couple of times, but we'll find our way.
Well, and that really, I think that's going above and beyond, and I think that's wonderful that you all do that for the community,
Yeah.
because I know that there are people that like you said, appreciate it, that have to do transports, or just people that just can't get out.
Right.
So.
And a lot of questions is, well, they're at homebound. How are they at risk?
Well, and I was wondering that too, but I just thought, well, maybe I shouldn't ask that. But yeah, okay, since you did, I mean, I do wonder that.
Well, they may have one caretaker, or they have multiple caretakers, and those caretakers and their immune system
visitors.
is really low, and their resistance is low, so they're going to be more at risk than most people, and they want to keep their loved ones around like everyone else does.
Deanna, how would someone schedule an appointment to get more information?
Well, like I said, there's 2 different programs. We'll do the outreach is through 352-383-4554. And then the second line, like I said, we'll advertise it. The reason we do a separate flu line is because we do get a lot of calls generated, and it's kind of hard for all of us to sift through all of them. So there's a certain line that we'll advertise, and it'll be in the paper and they'll call that line and leave the message.
Okay.
And then we'll schedule the appointment from there. We'll take all their where they live, their name, things that we need to know to get to them, and try to get the directions right.
Now, tell me,
Candace,
Dr.
I'm like
Jones,
that.
why is the flu something that you need to get a vaccine every year for?
Because the virus changes. Okay, so the actual virus we made a vaccine to in 2009 may not be the same virus we have this year. So that's why the vaccines continue to change and the actual components of the vaccine changes.
And how are viruses selected to make the flu vaccine?
Okay, everything starts with the what's called the WHO, the World Health Organization, and they actually send down recommendations worldwide to the actual viruses that are available, you know, in the world, in the environment. So it's up to every country to come up with their own recommendations on which viruses they want to include in the vaccines.
And how are they figuring this out? I mean, is it through animals? I mean, how do they figure out what the...
Well, most of it is from human contacts.
okay.
So they actually test humans who come in with certain symptoms. And in Florida, we actually have a surveillance system where individuals who come in with certain symptoms, flu-like symptoms, we actually report it to the actual state. And the other recommendations come in through the CDC and what's called the Advisory Committee on Immunization Practices. And they actually give the actual recommendations on the inclusion of the vaccine.
And when do they make this decision? So, because obviously they have to produce the vaccine also.
Mm-hmm.
So are they doing this in the summer, or when is this?
Typically January, February is when they make
For next year?
gathering the data. Yeah, for
Okay,
the
so they're
coming
figuring
year.
out this year, and then they're doing it.
And the CDC has if you're looking for information, the CDC, the Health Department website has a lot of information. You can pull up any question you have is in the CDC website or the Health Department.
And do
Lake
you have the
County Health
names of those websites?
Would be cdc.gov, and then you can search influenza or flu, and there are enormous amounts of material on that.
And will they have some of the information that you have in
Oh,
front of you about the
absolutely, yeah.
washing your hands?
Yeah, the Health
and-
Department, the reason I brought them because this came out, it's really, it's a seasonal, and then they have treating seasonal flu at home with your children, which is great handouts for them. I was impressed, and Sherry Hutchinson actually brought them over for us to hand out through the community.
Well, and we're running out of time, and we didn't even get to any home remedies. I know you're supposed to feed the cold and starve the flu. Is that right? Or is it starve the flu and feed the cold? I don't know.
I just eat no matter what.
Something like that.
Keep your fluids up.
Yeah.
Very
Keep
important. You can
Yes.
use what we call medications that will bring down fever, such as Tylenol or ibuprofen.
Theraflu.
Yeah, if you are in an at-risk group, you should probably, which means that you have, some sort of your heart disease or that sort of thing, you probably should go see
the doctor,
your healthcare provider and look into getting the antiviral medications.
Well, I really appreciate all your time today and your expertise on this subject, and we just appreciate you being here and getting out the word about. I guess I got to go get my flu vaccine.
Yeah. If you need an appointment, give us a call.